For men over 60, the information presented below could be vitally important. Prostate problems become increasingly common with age, and many men are unaware of the everyday habits that can worsen the situation. If you've noticed frequent urges to urinate, difficulty starting or stopping urination, or waking up at night to urinate, it could be a sign of an enlarged prostate. It's important to understand that it's not always about age, but about what you do daily. Some men in their 60s, 70s, and even 80s maintain their health and experience no discomfort simply by changing a few habits. Others, on the contrary, suffer from ignoring warning signs. We will now look at 10 everyday habits that can gradually and imperceptibly contribute to prostate enlargement. Habit number 1 is the most dangerous of all. The goal is not to instill fear, but to provide the knowledge and tools to protect your health. By the end of this overview, you will understand how to stop prostate growth naturally and safely. Let's consider 10 habits that can negatively affect the condition of the prostate gland, even without your knowledge. Habit 10. Ignoring thirst and not drinking enough water. You may not realize it, but insufficient water intake can subtly affect your prostate. Older adults often reduce their fluid intake to avoid frequent trips to the bathroom, especially at night. However, this habit can lead to more concentrated urine, which over time can irritate the bladder and prostate. The prostate gland is located directly below the bladder, and when the bladder is under pressure, it also puts pressure on the prostate. Chronic dehydration leads to inflammation, and inflammation is one of the key factors in prostate enlargement. Many older adults also take medications that cause dehydration, and if they don't drink enough water, it only makes the problem worse. A dehydrated body can also accumulate toxins more easily, which puts even more strain on the urinary tract. Over the years, this slow damage can lead to prostate enlargement and frequent urination problems. The solution is simple. Drink water throughout the day, in small portions, even if you don't feel thirsty. Aim for clear or light yellow urine to ensure you're adequately hydrated. Maintaining adequate hydration soothes your bladder, reduces pressure on the prostate, and helps prevent unnecessary swelling. Don't avoid water out of fear. Use it as a natural shield to maintain prostate health for years to come. Habit 9. Prolonged sitting. The comfort of your favorite chair can become a treacherous enemy to prostate health. Prolonged sitting, especially without regular breaks, creates constant pressure on the pelvic area, which negatively affects blood flow to the lower body, including the prostate. Insufficient blood circulation can lead to inflammation and, as a result, prostate enlargement. Older adults who spend hours watching television, working at the computer, or reading put themselves at increased risk of urination and prostate problems. It's important to understand that it's not about giving up rest, but about the need for regular movement and avoiding prolonged periods of immobility. Inactivity also leads to weakening of the pelvic floor muscles, which makes it difficult to completely empty the bladder. Residual urine accumulating in the bladder has an additional irritating effect on the prostate. Implementing a simple habit, getting up every half hour and taking a short walk for a minute or two, can significantly reduce the risk of developing these problems. A light warm-up, a short walk, or even a few steps around the house helps maintain normal blood flow and relieve excessive pressure. Don't let a sedentary lifestyle cause serious health problems in the future. A little physical activity today is the key to peace of mind, health, and smooth operation of the prostate in the future. Habit 8. Excessive caffeine consumption. Many older people can't imagine their morning without a cup of aromatic coffee or an afternoon tea. However, excessive caffeine consumption throughout the day can have an irritating effect on the prostate and bladder. Caffeine, having a diuretic effect, stimulates increased urine production and forces the bladder to work in an enhanced mode. This can also lead to frequent contractions of the muscles around the bladder, causing frequent urges to urinate and incontinence. For people with a sensitive or enlarged prostate, this extra pressure becomes a serious problem. The impact of caffeine isn't limited to just that. It also contributes to the constriction of muscles in the bladder neck, making it difficult to empty the bladder completely. As a result, more urine remains in the bladder, putting even more pressure on the prostate. This leads to increased inflammation, more frequent trips to the bathroom, and general discomfort. While one small cup of coffee usually doesn't cause serious problems, consuming several cups of coffee, strong black tea, or energy drinks throughout the day can quickly lead to negative consequences. The key is moderation. After the first cup, try switching to decaf coffee or herbal tea to see if your urinary symptoms improve. Small changes in habits can give your prostate the rest it needs. It's not about giving up your favorite drinks, but about finding a balance between enjoyment and maintaining long-term health and comfort. The seventh detrimental habit affecting prostate health is the daily consumption of spicy and processed foods. Many older adults prefer dishes with a pronounced flavor. However, food with an abundance of spicy spices and subjected to deep technological processing can have a hidden irritating effect on the prostate gland. Spicy ingredients, such as chili peppers, black pepper, and hot sauces, can enhance inflammatory processes in the body, including the prostate area. While occasional consumption of spicy food does not pose a serious danger, regular consumption can provoke irritation, especially if the prostate gland is already enlarged. Processed foods, in turn, contain preservatives, artificial flavors, excessive sodium, and unhealthy fats. These components not only do not benefit health, but also have a destructive effect on it. High salt content, for example, contributes to fluid retention in the body and creates additional stress on the urinary system. Foods such as chips, canned meats, semi-finished products, and fast food can disrupt hormonal balance, in particular, testosterone production, which directly affects the condition of the prostate. Over time, a diet rich in such products leads to increased inflammation, weight gain, and hormonal imbalances, which are risk factors for the development of benign prostatic hyperplasia. If your diet is based on packaged products rather than fresh natural ingredients, your prostate is likely already suffering from it. It is necessary to give preference to natural anti-inflammatory products such as leafy greens, berries, and healthy fats. Healthy eating should not be boring and monotonous. Its main task is to protect your health, especially when it comes to prostate health. The sixth common habit that negatively affects the prostate is holding urine for excessively long periods. Everyone has postponed a visit to the toilet at least once in their life due to being busy or being far from a restroom. However, systematically repeating such a situation can cause hidden harm to the prostate. Prolonged retention of urine in the bladder leads to its stretching and overexertion. This creates additional pressure on the prostate gland, located directly under the bladder. Over time, this causes irritation and swelling of the prostate tissues. Older people are particularly vulnerable to this, as the muscles that control the bladder and prostate weaken with age. Holding urine can also lead to incomplete emptying of the bladder, which leaves residual urine, an ideal environment for the growth of bacteria and the development of inflammation. This can trigger infections that further irritate the prostate and contribute to its enlargement. It should also be remembered that the discomfort caused by these problems can negatively affect the quality of sleep and mood. To protect your prostate, you need to listen to your body's signals. You should not postpone a visit to the toilet, especially if you are trying to improve sleep quality or reduce the number of nighttime urges to urinate. A simple habit of emptying the bladder at the first urge can prevent the development of long-term problems. It is important to remember that the bladder and prostate are an interconnected system. If one organ experiences overload, it affects the other. Do not ignore the natural needs of your body. This is one of the best measures for preventing prostate diseases. Dangerous habits and prostate health, an insider's view. Smoking and neglecting preventive examinations are two factors that can deal a serious blow to prostate health. Habit number 5 is tobacco smoke, active or passive. Smoking is the worst enemy of the prostate. Inhaling tobacco smoke, whether actively or passively, has a devastating effect on this vital organ. The chemical compounds in cigarettes disrupt blood supply, provoke inflammatory processes, and damage the delicate tissues of the prostate. Moreover, smoking contributes to oxidative stress, reducing the body's ability to self-repair. Over time, this can lead to prostate inflammation, enlargement, and even increase the risk of cancer. Older adults are particularly vulnerable, as their bodies are less effective at coping with the negative effects of tobacco smoke. The longer a person is exposed, the greater the damage to the prostate. Smoking also depletes the body's antioxidant reserves, weakening natural defenses against prostate-related issues. Even if a person quit smoking many years ago, regular exposure to secondhand smoke can negatively impact their health. If you still smoke, it is worth consulting a doctor who can help you choose the best way to quit this harmful habit. There are various support tools, nicotine replacement therapy, and even natural remedies that can help you quit safely and effectively. Positive changes will not be long in coming. Within a few weeks, blood circulation will improve, inflammation will decrease, and the prostate will begin to recover. If you have managed to avoid this bad habit, try to avoid secondhand smoke. This simple decision can give you years of healthy life and save you from urination problems. It is never too late to protect your body. Habit number 4 is ignoring regular medical checkups. Many men postpone visiting the doctor until they feel unwell. This approach can be dangerous, especially after the age of 60. The prostate can enlarge asymptomatically, and only preventive examinations can detect the problem at an early stage. Regular checkups allow you to identify signs of inflammation, infections, or neoplasms before pain occurs. For example, a digital rectal exam and a PSA test are simple, quick, and often life-saving procedures. Refusing these routine examinations deprives you of the opportunity to take timely action. Some men are embarrassed to talk about problems with urination or the prostate, but the sooner you see a doctor, the better the chances of successful treatment and natural restoration of health. Delaying examination can lead to minor problems developing into serious diseases, such as urinary retention or prostate infections. Visiting a doctor at least once a year to discuss the condition of the prostate is not just a way to calm your nerves, but also a powerful tool for prevention. Early detection of a problem often avoids medication or surgery, limiting itself to lifestyle changes. Do not wait until the symptoms become unbearable. Prevention is the most sensible strategy for men over 60, especially when it comes to prostate health. Habit number 3 that can negatively affect a man's health is excessive consumption of red meat. Although this product is an important part of many diets, its daily presence on the menu can subtly increase the prostate gland. Scientific studies demonstrate that frequent consumption of red meat, especially processed meat such as bacon, sausages, and deli meats, provokes increased inflammatory processes in the body, including in the prostate. The key factors here are saturated fats and chemicals used in meat processing. These components can disrupt hormonal balance and increase the level of oxidative stress, which leads to inflammation of the prostate. In older people, digestion slows down, and red meat takes longer to process. This slowed digestion exacerbates the problem, leading to weight gain and creating additional pressure in the pelvic area. Of course, there is no need to instantly become a vegetarian, but reducing red meat consumption to once or twice a week can have a significant positive impact. It is recommended to replace it with lean sources of protein, such as fish, legumes, or grilled chicken. It is also helpful to include more plant-based foods rich in fiber in the diet, such as lentil stews or vegetable soups. These foods support prostate health and improve digestion. The body will thank you with a reduction in symptoms, an increase in energy, and an improvement in long-term prostate function. You do not need to give up your favorite dishes, just reasonably balance your diet. The prostate will feel the difference with each healthier meal. The second harmful habit is an excessive amount of fat in the abdominal area. As you age, excess weight around the waist becomes more than just an aesthetic concern. It's a serious signal of potential prostate problems. Fat deposits in the abdominal area produce inflammatory substances that circulate throughout the body, including the prostate gland. This constant inflammation irritates the prostate, contributes to its enlargement, and increases the risk of urination problems. Men with larger waistlines are more likely to suffer from prostate enlargement, frequent nighttime urination, and even erectile dysfunction. Furthermore, excess fat disrupts hormonal balance, particularly the levels of testosterone and estrogen, which influence prostate size. The solution isn't extreme dieting, but rather gradual and sustainable lifestyle improvements. A short daily walk, reducing portion sizes, and cutting back on sugar consumption can help reduce abdominal fat deposits. Even losing a few pounds can lead to noticeable relief from urination symptoms. It's important to remember that abdominal fat puts pressure on the bladder and pelvic organs, increasing the strain on the prostate. Achieving a healthy waist size, generally less than 40 inches, is one of the most important steps toward long-term prostate health. Don't ignore weight in the abdominal area. It's not just fat. It's a sign that the body is under stress. By reducing it, you can feel relief not only in terms of clothing size, but also in the condition of your prostate. The first harmful habit to address is a lack of control over chronic stress. Many mature adults neglect this factor, underestimating its destructive impact on the body. Chronic stress, like a hidden enemy, undermines prostate health. A constant feeling of worry, tension, and anxiety triggers the release of stress hormones like cortisol into the bloodstream. Prolonged exposure to these hormones leads to inflammation, muscle tension, and hormonal imbalances, negatively affecting the prostate. Stress causes spasms in the pelvic floor muscles, which impairs blood flow and irritates the nerve endings surrounding the prostate. Additionally, it weakens the immune function, reducing the body's ability to fight inflammation and infections. Often, older individuals stoically endure stressful situations related to financial difficulties, family problems, and declining health, leading to the accumulation of negative consequences. This results in frequent urges to urinate, pain, and prostate enlargement. However, there's good news. The situation can be brought under control. Simple yet effective methods, such as daily deep breathing exercises, moderate physical activity, stretching, and even 10 minutes of quiet and peace, can reduce stress levels. Laughter, socializing with loved ones, and getting enough sleep are a healing balm for the mind and prostate. Managing stress isn't just a way to improve well-being. It's an opportunity to heal the body from within. By changing your lifestyle, you can reduce unpleasant symptoms and stop prostate enlargement naturally. This is the most effective step toward a healthy, peaceful, and comfortable life. Now that you know the main habits that negatively affect prostate health, the question arises, what to do next? Don't view these changes as minor adjustments. They're powerful steps that can prevent months or even years of discomfort, sleepless nights, and unnecessary medication. People over 60 need to act immediately, without waiting for symptoms to worsen. Start by changing just one habit this week. Drink more water. Increase physical activity. Skip that extra piece of bacon. Every action matters. The process of prostate healing doesn't happen instantly, but with the right approach and consistency, the body is capable of working wonders. It's important to remember that you're not alone on this journey, and with the necessary information, it's never too late to begin healing. Take care of your prostate, and it will reciprocate.